Hi, Dr. Ghalambor here. I'm a fellowship trained and double board certified interventional spine and joint or interventional pain specialist from Harvard Medical School. And I'm currently working at NorTex Spine Joint Institute with offices in Plano, McKinney, Frisco, and hopefully soon in Allen, Dallas, and other locations. So, we're talking about Piriformis Syndrome, or problem with the piriformis muscle. So I have a lot of people come in to me and say, hey doc, how can you treat my Piriformis Syndrome? And my first question is, well, how do you know it's a Piriformis Syndrome? Kind of read about it, it kind of fits the picture, or sometimes, the rehab guy at the gym or my trainer, and pretty much they might be in the ballpark area, they might be right, but like many other spine, joint, and pain conditions, the most important part of treatment is the right diagnosis. So here, piriformis, Bob here doesn't have any muscles, but piriformis is a muscle literally in the buttock area. And if you have spasm of that muscle, you have pain in the buttock. Now, here's the challenge though. If you have problem in the lumbar spine, be it a disc problem or arthritis of the joint, not only you get back pain, but also you get what we call refer pain to the buttock area. And sometimes the refer pain is actually more intense than the low back pain. So you can have a buttock pain right over your piriformis muscle that is in fact coming from the structures above. A good example of referred pain is if somebody has a heart attack, sometimes they only have chest pain, but sometimes they only have left arm pain. And so if somebody comes to us and say, hey, I have left arm pain, they're my age or older, they're not in shape, they have some risk factors, what we think about is like, first, let's make sure he doesn't have a heart attack. Because we know, left arm, male, smoker, history of heart attack in family. So we don't necessarily go by where the pain is. Sometimes it's right. If the pain is here, over the sacroiliac, over the piriformis muscle, it is piriformis. But what just slipped out was the sacroiliac joint. So piriformis muscle is exactly right over the sacroiliac joint, and you can have sacroiliitis, or you can have refer pain from other structure. Bottom line, before you actually treat a quote-unquote diagnosis, you would need to confirm that diagnosis, and that is our specialty. We not only examine you, order studies to confirm the diagnosis, but a lot of times what we need to do are what we call diagnostic blocks or diagnostic injections to rule in or out one diagnosis versus the other before we actually go towards the treatment path. Well, thank you so much for watching.